New reports are suggesting that just 10% of people who test positive for coronavirus need to be isolated or traced. According to the New York Times, which you may recognize as not a very conservative outlet, has published a report that is very damaging to the mainstream lockdown, everybody run for your lives, get out of my restaurant narrative. They say, standard tests are diagnosing huge numbers of people who may be carrying relatively insignificant amounts of the virus. Most of these people are not likely to be contagious, and identifying them may contribute to bottlenecks that prevent those who are contagious from being found in time. Remember, this is the New York Times telling you this, not me, not Donald Trump. I've barely put any opinion in these coronavirus segments, if at all, yet for people like myself and others, what Doug Ford and other politicians, especially those in Australia, for example, see is conspiracy theorist.
Take it down.
And in case they're watching this, I'm not sure that they will, since they can watch every other outlet who just bow to whatever they say. Maybe you can send this to them. Here's more evidence for them. Quote, in 3 sets of testing data that include cycle thresholds compiled by officials in Massachusetts, New York, and Nevada, up to 90% of people testing positive carried barely any virus, a review by the Times found, end quote. So where exactly does that leave us? Well, the health agencies have gone back on almost everything they initially stated: masks, surface spreading, contagiousness. No one believes them anymore. For example, you might hear something along the lines of, well, they just didn't want a mask shortage, which is actually an excuse because it means the same as they're liars. So take the information I just gave you and combine that with the fact that only 6% of COVID deaths are from the virus only. Take that and think about the current restrictions where you live. Are they reasonable? Do you require more information about it to make these decisions? Well, here's some more. From CNN, you might recognize them as another Democrat support system. They say, the CDC, quote, has changed its COVID-19 testing guidelines to say some people without symptoms may not need to be tested, even if they've been in close contact with someone known to have the virus. Of course, as you might predict, further down, CNN says the following. A senior federal health official close to the process tells CNN that the sudden change in COVID-19 testing guidance was the result of pressure from the Trump administration. When asked by CNN whether the CDC was responding to pressure from the White House and the Department of Health and Human Services, the senior official said it's coming from the top down. So basically, CNN is asking itself a question so they can get the answer that they desire. Are you following this closely now? Because when Dr. Fauci says masks don't work, the response is no, he's lying. And when he says you must wear a mask while watching a baseball game with the mask around his chin, he's telling the truth now. When the CDC says test everyone, yes, very true. Now, if you have no symptoms, you don't need to be tested.
Liars, this is Trump's fault.
Whatever advice results in siphoning tax dollars and keeping small businesses closed is approved by the media. If anything counters that narrative, excuse me, I'd like to hear another source on that, please. There has never been any evidence that masks or lockdowns, or social distancing for that matter, actually slow the spread of the virus. It's just assumed. Droplets and spits, they say. Put your mask on and shut up. Yes, that's actually a line from people like Derek Thompson of The Atlantic. They're actually saying this, they actually believe it. The self-proclaimed anti-authoritarian journalists do everything the authorities ask them to do. Not only is there a lack of evidence that masks stop the deadly viruses, there's even studies that state they're just a formality in surgery rooms, if you can believe it. A 2015 study from the Journal of the Royal Society of Medicine says, quote, overall there's a lack of substantial evidence to support claims that face masks protect either the surgeon or the patient from infectious contamination. More rigorous contemporary research is needed to make a definitive comment on the effectiveness of surgical face masks, end quote. If no one can prove that masks do anything in operating rooms with open wounds and body parts, and on the very labels of the mask boxes they say they don't protect against diseases, then what is this all for? Just placebos to ensure crazy people who want to yell at you in the grocery store feel good? This is not a valid reason to take away my rights, and people should speak up about it. Don't forget to like, share, and subscribe, and go to maskexemption.ca to get your mask exemption card today.